Good evening, students. Once again, this is Obeng series. Today we come to discuss about a very important topic, which is the pituitary gland and its functions. As an eye care professional or even a general medical doctor or in other specialties, you need to know about the functions of the pituitary gland because it has impact on your sight once it becomes more functioned. Remember that when it gets malfunctioned, you cannot directly check from the gland itself. Its malfunction will be manifested through certain hormones that will be underproduced or overproduced. So, let me tell you why we needed to talk about the pituitary gland and its functions. For example, in our last class, we talked about the optic nerves, the left and right, how they meet at the chiasma, and at that same level, okay, we have the pituitary gland. Look at the pituitary gland here. This is the optic chiasma, all right? That's where the left and right optic nerves they meet. So here you are. That is the optic chiasma. The third ventricle and hypothalamus will be up here. And here you have the pituitary gland. So imagine that it becomes bigger than usual. What will happen to it? Alright? It will grow and compress the optic chiasma. Sometimes it will affect the function of hypothalamus and of course the third ventricle. So it becomes enlarged and compresses the optic chiasma, which is superior to it. Once the chiasma is compressed, it will have impact on your vision and of course your visual fields. And the reason why we needed to talk about it is because so far as it is functioning well, there's nothing to worry about. But once it is malfunctioned, we should be able to detect that it is malfunctioned, know the negative impact it has on our sight, and work together as professionals in the medical field. So, to set the ball running, remember that the pituitary gland has an anterior lobe and a posterior lobe. Anterior lobe and a posterior lobe. The anterior lobe produces as many as 8 hormones, whereas the posterior lobe produces only 2 hormones. So, the anterior lobe. It is also said that the pituitary gland is a master gland of the whole body because it is in control and determines what other glands do in the body, what they release in higher or in lesser quantity. The first hormone that I want to talk about, produced by the anterior lobe. Of course, we're going to talk about the anterior lobe first. Then after that, we'll talk about the posterior lobe. The first hormone I want to talk about, so far as the anterior lobe is concerned, is follicle stimulating hormone. Follicle stimulating hormone. As you can see, alright, it works basically on the testes and then on the ovaries. Okay? Then we have luteinizing hormone, LH, which basically acts on the ovaries. Another one is adrenocorticotrophic hormone, ACTH. Adrenocorticotrophic hormone. What does it do? It acts on the adrenal cortex. Alright? Then we have the thyroid stimulating hormone, TSH. Thyroid stimulating hormone. It acts on the thyroid gland. It acts on the thyroid gland. Then you have the beta lipotrophins, which is not represented over here. Okay? The beta lipotrophins is not represented on this sketch. But we have what? Prolactin. Prolactin, okay, it acts on the breast. Prolactin. Then you have the growth hormone, okay. Look at the growth hormone. It acts on the muscles and then the bones. Growth hormone acts on muscles and what? And the bones. Then you have MSH or melanocyte stimulating hormone. MSH or melanocyte stimulating hormone. Alright? It acts on the skin. It acts on the skin. Let's shift our attention to the posterior lobe of the gland. There are two basic hormones that are produced there. Antidiuretic hormone, also known as what? The vasopressin. It acts on the kidneys. Antidiuretic hormone or vasopressin. It acts on the kidneys. Then we have oxytocin. Okay? It acts on the breast. And of course, it acts on the uterus also, but it is not represented here. There you are. Let's talk about some of the functions. Okay? Let's talk about the functions of the pituitary gland. As a master gland, which controls many of the glands in the body, as I say, it will have impact on your size because once it becomes bigger, it increases in production and has an impact on your side because it will have compressed the optic chiasma and the fibers that cross the chiasma. Okay, the nasal fibers. Here we are. That's the pituitary gland for you. Okay, once it becomes bigger than usual, it will compress the optic chiasma, as you can see it represented here. And in extreme cases, it may have negative impact on the tail ventricle and of course the hypothalamus. So, what is the function of follicle stimulating hormone? It helps in regulation of menstrual cycle. Okay, the follicle stimulating hormone, alright, it has what? It regulates menstrual cycle by acting also on the ovaries and also having effects on production of estrogen and progesterone. Of course, it also has impacts on the testes. Alright, so let's talk about LH or luteinizing hormone. It plays important role in gonadal function. Okay? It plays important role in gonadal function. What are your gonads? Your gonads are the testes, okay, in males and ovaries in females. The gonads are the testes in males and what? The ovaries in what? Females. So, luteinizing hormone or LH plays important role in gonadal function. How much hormone is produced by the testes and ovaries? This is determined by the luteinizing hormone. Let's talk about combination of follicle stimulating hormone and luteinizing hormone. Together, they stimulate follicular growth and ovulation. So, follicle stimulating hormone and luteinizing hormone together, what do? They stimulate what? Follicular growth and ovulation. So the follicles and their growth and ovulation is dependent on follicle stimulating hormone, as the name goes, and luteinizing hormone. Let's talk about adrenocorticotropic hormone, ACTH. Adrenocorticotropic hormone. It stimulates adrenal glands to produce cortisol, okay, or to release cortisol. So ACTH adrenocorticotropic hormone. What does it do? It stimulates adrenal glands to release cortisol. ACTH. What? Stimulates adrenal glands to release cortisol. What does cortisol do? Cortisol regulates body stress response. Let's talk about thyroid stimulating hormone. Thyroid stimulating hormone. What does it do? It regulates the production of thyroid hormones by the thyroid gland. So the thyroid gland produces hormones, but it's the thyroid stimulating hormone which stimulates the thyroid gland to produce the hormones in lesser or in larger quantities. FT3, FT4, tetrahydrothyronine and trihydrothyronine. These are the major hormones that the thyroid gland produces. Beta lipotrophins is not represented here, but remember, beta lipotrophins stimulate melanocytes to produce melanin. Beta lipotrophins, which are not represented here because in the past they were thought not to have function, but recent studies have produced evidence that beta lipotrophins may what? Have functions. What do? They stimulate melanocytes to produce melanin. So they may have effects on what? The skin. They stimulate melanocytes to produce melanin. Again, it intervenes in lipolysis and steroidogenesis. So, beta lipotrophins, they do three major things. Stimulate melanocytes to produce melanin. They also may help in breakdown of cholesterol or lipids, and they may also help in synthesis of cholesterol or steroidogenesis. Let's talk about prolactin. What does prolactin do? It intervenes in several functions in the body, but there are two principal ones that we cannot overlook. I say prolactin intervenes in several hundreds of functions in the body, but there are two major ones that everybody in the health profession should know about. One, prolactin helps in milk production, and two, it helps in development of mammary glands. So prolactin helps in milk production, okay, as you see it acting on the breast. And number two, it helps in development of mammary glands. It means development of the breast. So it helps in development of the breast and also production of milk. Let's turn our attention to growth hormone. Growth hormone. What does the growth hormone do? It regulates growth. In other words, our height, okay, bone length, okay, muscle growth. So growth of muscle and growth of bone, okay, they are dependent on what? The growth hormone. Studies have also shown that growth hormone intervenes in normal brain function. It also regulates levels of cholesterol in adults. When people have finished growing, they still need growth hormone. Why? One, to help in normal brain function, and two, to help regulate levels of cholesterol. So that's the growth hormone for you. Okay? That is it. Then we have melanocyte stimulating hormone. Melanocyte stimulating hormone. What does it do? Intervenes in production of melanin. It protects the skin from ultraviolet radiations. It also helps in development of pigmentations and control of what? Appetite. In a nutshell, Melanin stimulating hormone stimulates melanocytes to produce melanin. So, melanocytes stimulating hormone, it stimulates melanocytes, okay, to produce melanin. And once there's enough melanin, our skin is protected against ultraviolet radiations, okay. And another function you should know about the melanocyte stimulating hormone is that it is able to control our appetite. Once there's enough melanin, our skin is also protected against the development of cancers, okay, and carcinomata on the skin and other parts of the body where melanin is needed. Now, let's shift our attention to the posterior lobe of the pituitary gland. The posterior lobe. What are the two major hormones produced there? ADH, which is antidiuretic hormone, also known as what? Vasopressin. And the second one is what? Oxytocin. Okay, so what does ADH do? It causes the kidneys. You see, when you talk about diuresis, it means production of fluid that exits the body. Antidiuretic means it works against diuresis. So antidiuretic hormones, what do? It causes the kidneys. Okay, antidiuretic hormone, it causes the kidneys to release less water. It decreases the amount of urine produced. What it means is that a high antidiuretic hormone causes the kidneys to release less urine, and a low level results in greater urine production. Another name for antidiuretic hormone is also known as what? Vasopressin. When we hear vasopressin, it means pressing of what? The blood vessel. What does it mean? It has the potential of constricting effects on arterioles throughout the body. So it's able to constrict arterioles throughout the body once its release is in high quantity. The last but not the least hormone to talk about is oxytocin. Although not represented here, oxytocin acts on the uterus, helping it to contract in childbirth and also in lactation after birth. So uterine contractions are provoked by the presence of what? Oxytocin in childbirth. And it also helps in what? Lactation after birth. It is important to note that studies have shown that oxytocin also affects human behavior, male and female reproductive systems. So oxytocin, apart from helping in uterine contraction and during childbirth and in lactation after birth, studies have shown that it affects human behavior. It affects male and female reproductive systems. Remember that many of these hormones are produced by males and females. And the master gland in the body, being the pituitary gland, has impact on the optic chiasma and of course sometimes the third ventricle. And once it has impact on the optic chiasma, it has impact on our sight. And this is the pituitary gland. And as I've shown you, once it grows bigger, the distance between the gland itself and the chiasma is 1 centimeter or 10 millimeters. Once it becomes bigger than that, it enhances its production of these hormones that we are speaking about. So the individual will have manifestations of all the problems that we have spoken about. So there will come a visual problems. So once you find out that these visual problems are attributable to possible pituitary problem, then you ask the client to go and do all these hormonal tests and come with the results. In our subsequent classes, we are going to discuss about visual fields. Until we meet again, I will urge you to continue learning hard and put down any questions if you have any. That when we meet in class, we can talk more about it. Stay focused.